Hi, Dr. Matt here. In today's video, what I want to do is I want to go over 4 steps to help get rid of knee pain. So often we have people come to us that want to avoid surgery, want to avoid the drugs, but they've been told they have bone on bone, they've been told that they have arthritis in their knee, they've been told that they're just going to have to live with what is going on inside their knee. So I want to give you some tools, some things to look for in preventing knee pain. So for the first thing we have here is it's very important that your legs and the biomechanics of your joints are stable. So what does that mean? Well, your legs need to be the same length essentially. But what happens is at times our legs anatomically can become shorter as a result of shifting up here in the pelvis. Now, one thing you could do is you could have a family or a friend look at your leg length by having you lay down on the bed and seeing which foot is longer and which foot is shorter. Another thing you could do is you could just stand up on flat ground and you could see, do you have a high pelvis on one side versus the other? That will tell you if you're putting more weight on one knee and less on the other and wearing down that knee and that cartilage inside that knee much faster, okay? What this will also do is this is also going to cause an imbalance in the muscles over time. And so people ask me, well, why does the biomechanics and the movement of that joint, how does it go bad? Okay, how does it get worse over time? Well, there's really 2 causes of that. One is traumas. Traumas could be from sprains, falls, auto accidents, okay? It's going to cause an injury to a joint, which is going to cause ligament laxity. The muscles are going to want to compensate in order to stabilize that joint. And long term, it creates muscle imbalances and wear and tear on the joints. However, that isn't the most common cause of joint pain. The most common cause of joint pain actually comes from repetitive traumas, from sitting all day at a computer, from running, from going upstairs, from getting on your knees. Maybe you're a plumber, maybe you lay hardwood floors and you're on your knees often. Maybe you're cross-legged with kids on the floor, okay? And watching the kids, you're on the floor cross-legged with them. These put abnormal stresses on the joints. And this repetitive trauma over and over and over and over again starts to wear that joint down and that tissue down inside of that joint. So it becomes much more painful and we get these muscle imbalances that begin to happen. What's interesting, though, is that the literature says that sprains, falls, auto accidents is not the primary cause of joint pain. It's actually repetitive traumas. In fact, about 80% of the people with joint pain can't recall a major trauma to a joint. It's the repetitive little traumas that have happened over years and years and years that wear and tear those joints. So that wear and tear then begins to imbalance the muscles, which is our second thing here. So you want to make sure you correct the muscle imbalances. As your body starts to compensate, and as your body starts to overcome imbalances within the joints and the poor biomechanics, it starts to tighten up and scar tissue begins to build up. This is where you're going to start to notice a shortening in muscles. You're going to find out that maybe your hamstrings become very tight or your calves always kind of tend to come tight after you've been walking for maybe 20 or 30 minutes, okay? Maybe even less than that. You're also going to find that some of the muscles that were helping to support your body before have now become weak and fatigue very quickly. So this imbalance between different types of muscles that we have to help to move our body and then help to support our body during times of no movement become imbalanced. This imbalance develops scar tissue. So a normal tissue should lay nice and parallel just like that, so the muscles are sliding together. Now, over time, with these imbalances, scar tissue and these muscle fibers will lay in different directions. It's these fibers And this tissue here that creates that pulling and that tightness in the muscles and doesn't allow those muscles to properly move that joint, which is going to eventually decrease the range of motion in that joint and accelerate arthritis. Many times what we'll do is we'll just take a Tylenol or aspirin to cover up that pain, or maybe you go get a massage in order to work out that trigger point. In another video, I'm going to show you some very specific areas in the knee that could be tender, which would identify abnormal motions within that knee, and you would know if you have muscle imbalances beginning to develop. The third thing we want to do is we want to begin to reduce inflammation. Now, this isn't just inflammation in the joints. This is inflammation as a whole in the body, okay? I know myself, my joints get very inflamed. So at the beginning of this year, actually, I kind of changed my diet, and I've been doing some research on what is called intermittent fasting. And I've got that right here as IF, intermittent fasting. And when you intermittent fast, it allows your insulin levels in your body to begin to come down. And insulin is very inflammatory to your body. So the more insulin you have, it's like pouring gasoline on a fire. It just becomes very hot. And so does your body, and so do your joints and muscles oftentimes. So I went through the beginning of this year, and I did actually I did about a 5-day fast. It was a low calorie fast, maybe 500 calories. However, it lasted for 5 days. But it was the first 24 hours of giving my body a rest from food that I saw all the inflammation and pain reduce out of my joints. It was very incredible, and I was surprised at how fast I responded from it. And I'm sure a number of you all are going to respond equally as fast. Now, when you may be thinking, well, if I fast and I don't eat for 24 hours, or maybe I don't eat for 18 hours, how do I sustain in between my meals and not be hungry? Well, you have to change the nutrients that you're getting into your body. So you want to add a very high calorie nutrient such as fat. So we want to start adding high amounts of good fat to your diet, about 40% protein and a very low amount of carbohydrates, maybe 10, maybe 5%. But the majority of your meal should be about 60% fats. And I know that sounds crazy. You're going to think, well, if I eat all of this fat, will I get fat? Absolutely not. In fact, if you eat a lot of good fats, it's anti-inflammatory to your body, and it'll allow your body to release the bad fat and get it out of your body so you can burn it properly. So a couple things you can do to start that process is start with eating just 3 meals a day. Cut out your snacks, okay? It's one of the best things you can do, even for diabetics. Start to cut out your snacks. You may see your blood sugar rise a little bit in between, but what's going to happen is your body's going to begin to adapt to this new way, and it'll start to really, really like things. Now, if you have challenges with it, you may need some assistance. And if you need some assistance, you can go to our website and you can see one of our providers, Dr. Priest, who works with diabetics regularly and helping them get their blood sugar down without adding any more drugs or medications to it. And then eventually what you're going to want to do is you're going to want to go down to 2 meals per day, okay? Now you'll still get your normal caloric intake, but we're going to put it into 2 meals per day and allow your insulin levels to come down the rest of the day. There's also 2 supplements that we really like to use. One is turmeric, which is an anti-inflammatory. The other one here is a blended support. It's a tendon ligament support that specifically gives you tendons and ligaments nutrients to reduce the inflammation. The fourth thing here that you can do to help joint pain and really help joint pain and really reverse the damage of the wear and tear that's happened over time, and this is regenerative stem cells. So think about your joints and them wearing down and that cartilage wearing down. Well, in the past, you just had to have cartilage that was worn down, and eventually it would lead to maybe a knee replacement. Well, now what we have is the ability to use stem cells to help to regenerate the joint and regenerate the tissue. We're going to start putting out a bunch of videos on stem cells. In fact, you'll be able to go to our YouTube channel. You'll see them on Facebook. If you haven't liked our Facebook page or liked this video, please like it, share it with other people. But you're going to learn a lot more with stem cells and how this is really starting to help people with chronic arthritis, chronic inflammation, and get those joints rebuilt. So I look forward to seeing you on future videos. And if you have any questions, check out our website at lifeworkskc.com, where we've got a plethora of information on our blog and on our YouTube page.